Hello, our today is on the disease Methemoglobinemia. This project was done by Payton, Emma Pitt, and Holden Summers. Methemoglobinemia, also known as erythrocyte reductase deficiency, or MET-HB, is a disease where methemoglobin is produced in abnormal amounts, which is when red blood cells contain over 1% methemoglobin. The disease causes red blood cells to not properly deposit oxygen into the body's cells by oxidizing iron from reduced ferric state to the oxidized ferric state. The disease can be genetic or acquired. There are two types of genetic methemoglobinemia, type 1 and type 2. Type 1 exhibits an autosomal recessive pattern of inheritance and is when the body lacks the enzyme cytochrome B5 reductase. The second and more deadly type is type 2. It exhibits an autosomal dominant pattern of inheritance and is when cytochrome B5 reductase does not work in the body. The disease is rare, with only 3,000 cases reported in the United States per year. There is an increased frequency of this disease in Native American populations.
There are two main causes of methemoglobinemia. The first is by inheritance. With inheritance, you can have type 1, which is where the red blood cells lack the enzyme cytochrome B5, type 2, where the enzyme cytochrome B5 is present but insufficient, or hemoglobin M disease, which is a defect in the hemoglobin protein itself. You can also get methemoglobinemia by exposure, and this can be by anesthetics such as benzocaine, lidocaine, and prilocaine, antibiotics, nitrates, chlorates, which can be found in matches, explosives, and weed killers, dyes that contain aniline, and nail polish removers that contain acetonitrile. Methemoglobinemia can be diagnosed by many tests, including pulse oximetry, complete blood counts, and even a urine pregnancy test. Each cause of methemoglobinemia came with their own set of symptoms and complications. Type 1 showed a bluish coloring of the skin, as shown on the picture on the left. Type 2 came with developmental delay, failure to thrive, intellectual disabilities, and seizures. Hemoglobin M disease also showed a bluish coloring of the skin, and with exposure you can expect to see bluish coloring of the skin, headaches, giddiness, altered mental state, fatigue, shortness of breath, and lack of energy. The picture on the right is a famous portrait of the Fugate family of Troublesome Creek in Kentucky. The family carried the type 1 autosomal recessive form of the disorder, and the disease was passed down from generation to generation for 200 years, up until 1975.
Methemoglobinemia is obviously a blood disorder that we know has to do with the amount of oxygen in blood. So it makes sense that most of the abilities that we have to diagnose this condition has to do with testing your oxygen levels in your blood. So we have one that's called CBC, which is just an analysis of your complete blood count. We also can do tests to check for certain enzymes that you have, an examination of your blood color, because clearly if you have this disease, your blood color is going to be more blue, hence the bluish tone to your skin. We also have a pulse oximetry to check, which just estimates the amount of oxygen in your blood. And then DNA sequencing will also tell us, because the two types of this disease, one is genetic and one can be acquired. So the ones that is genetic would obviously show up in your DNA sequencing. So while there is no cure for this disease, if you have it genetically, there are ways you can, not acquire the symptoms. And then those who have it acquired, the first treatment is with the infusion of methylene blue, and this medication usually helps people very quickly. It's very fast acting, but unfortunately this methylene blue can't be used on people who have the congenital type of methemoglobinemia. And then people who don't respond to methylene blue may just need a possible blood transfusion, and those with the type 1 hereditary methemoglobinemia may receive aspirin therapy. So one thing is, we know that type 1 congenital methemoglobinemia don't have symptoms. Their condition is benign, but that doesn't mean that they won't develop an acquired form. So people who know that they have the genes for type 1 should not take drugs such as benzocaine or lidocaine. And a way that you can prevent that is obviously staying away from benzocaine. So especially if you're getting, drugs over-the-counter products, you have to make sure you're reading the labels, because benzocaine is in a lot of those products, including aspirin and different stuff that we use daily. Children should not, under age of 2, should not use benzocaine at all, because this is almost going to guarantee that they develop this disease. And adults should not use it more than 4 times a day, especially if you have a heart disease, smoke, or prone to asthma, bronchitis, or emphysema. Another way that you can develop an acquired form of this disease is if your nitrates in your groundwater. So if you have well water, do not boil your well water, because that concentrates your nitrates, and again, it will definitely lead to developing of the acquired form of this disease. Softening, filtering, and purifying your well water does not reduce the nitrates. So basically, if you know you have type 1, don't use well water is pretty much the way to prevent this disease.
The prognosis for people with methemoglobinemia depends on the type they have. For people with type 1, the prognosis is pretty good, though still experiencing some symptoms such as cyanosis. Their life expectancies do not change as long as they receive the correct treatment promptly. For people with type 2, the prognosis isn't as great, with the majority of people with this type succumbing to the disease early in life. Thank you for watching our presentation about methemoglobinemia. We hope this presentation was able to inform you about the causes, symptoms, diagnosis, treatments, and prognosis of the disease. If you have any questions about our presentation or methemoglobinemia, please leave a question in the discussion part of our video, and we will be happy to answer it.